Good day, fellow seniors. What if I told you that there are 3 incredibly simple exercises you can do right at home that can significantly improve your erection quality and bedroom performance, especially after the age of 50? And the last method is one you've almost certainly never heard of. You may not know this, but as you enter middle age, blood flow to your manhood gradually decreases. Your pelvic floor muscles weaken, and your ability to maintain a firm erection is no longer the same as in your younger years. This doesn't just affect your physical health. It can have a huge impact on your confidence and your married life. According to medical studies, more than 50% of men over 50 experience problems with their erections, with the main cause coming from the weakening of the vascular system and pelvic muscles over time. But you can absolutely improve this condition naturally, safely, and for the long term with the scientific exercises that I, Dr. Frederick, am about to share with you. And don't take your eyes off this video, because the last exercise on today's list is truly a secret weapon that very few men know about, yet it can bring about remarkable changes after just a few months of persistence. Before we begin, I'd really like to get to know you. Where are you watching this video from? Leave your answer in the comments. I'd be delighted to know who I'm sharing this journey of men's health with today. If this is your first time visiting the channel, don't forget to hit subscribe and turn on the notification bell so you won't miss any useful health tips for men over 50. So, what are we waiting for? Let's dive right into the very first exercise, the foundation for every improvement in your erection ability that you're about to experience. Exercise 1. Strengthen your pelvic floor with schedule exercises. When it comes to improving erections, many people often think immediately of medication or dietary supplements. But few people know that right inside the body, there is a secret group of muscles that acts as the foundation for the entire sexual health of men. That is the pelvic floor muscles. Why are pelvic floor muscles important? The pelvic floor is located at the base of the pelvis, like a hammock supporting the bladder, rectum, and especially the penis. When you have an erection, these muscles have the task of keeping blood inside the erectile tissue, maintaining firmness, and supporting ejaculation. If the muscles become weak, you will find it difficult to maintain an erection for long. Ejaculation control decreases, easily falling into premature ejaculation. The risk of urinary leakage and frequent urination also increases with age. On the contrary, when the pelvic floor muscles are strong, they act like a natural blood-locking valve, keeping blood inside the penis longer. This is the key factor that helps you achieve stronger erections, better ejaculation control, and even enhanced pleasure during orgasm. How to identify the pelvic floor muscles? The simplest way to find these muscles is the next time you urinate, try to stop the urine flow midway. The muscles you can track to do that are the pelvic floor muscles. Once identified, you can practice at any time while sitting at work, watching TV, or even lying down to rest. Standard schedule training guide for men. Warm up gently. Take a deep breath. Relax your whole body. Tighten the pelvic floor muscles. Imagine you are trying to hold in gas or stop the flow of urine. Follow the rhythm. Squeeze for 5 seconds. Right arrow. Relax for 5 seconds. Repeat 10. Times do 2-3 sets per day. Training duration. Be consistent for at least 6 weeks to feel the clear changes. Scientifically proven benefits. Improve blood circulation to the penis. Strong muscles help hold blood better. Control ejaculation. Many studies show that regular schedule training helps men increase their ability to delay ejaculation. Reduce nighttime urination, urinary leakage. This is a pleasant side effect of stronger pelvic floor muscles. Increase confidence and pleasure not only for you, but also for your partner. Common mistakes when doing Kegel exercises. Squeezing too hard. This makes the muscles fatigue quickly and easy to give up. Holding your breath when practicing. You need to breathe evenly so that blood circulates well. Using the wrong muscles. Some people contract the abdomen or buttocks instead of the pelvic floor. Tips to upgrade effectiveness. Combine Kegels with diaphragmatic breathing to increase circulation. Do cules when the penis is partially erect. This will create extra natural resistance, helping the muscles to be trained more strongly. Maintain this habit like brushing your teeth every day. The longer, the more sustainable the effect. When your pelvic floor muscles become flexible and strong, you will notice the difference not only in your performance in bed, but also in your confidence in facing daily life. And this is just the beginning, because the next method I am about to share will directly impact the process of bringing blood into the erectile tissue, helping you achieve maximum firmness faster and longer. If still here and following carefully step by step, that proves you truly care about your own health. Leave the number 1 in the comments below so I know you are still accompanying me. Exercise 2, vacuum therapy to improve blood circulation. In addition to training the pelvic floor muscles, there is a non-invasive method that has been widely applied in men's health medicine to support erectile function. That is vacuum therapy. This method is especially popular among men who have undergone prostate surgery or those who have difficulty achieving and maintaining an erection. Mechanism of action. The principle is very simple. The device consists of a cylindrical tube placed around the penis connected to a pump system that creates negative pressure. When pumped, the negative pressure will draw oxygen-rich blood into the erectile tissue, thereby creating a natural erection. After the penis has reached the desired firmness, the user places a constriction ring at the base of the penis to keep the blood inside, helping to maintain the erection during intercourse. The duration usually lasts from 10 to 15 minutes, enough for sexual activity to take place fully. Outstanding advantages. No need for medication. This is a safe alternative for those who cannot tolerate erection-enhancing drugs. Stimulate circulation. Regularly drawing blood into the erectile tissue also has the effect of training the blood vessels, maintaining the elasticity of the vessel walls. Supports recovery after surgery. Especially useful for men after prostate surgery, as it helps prevent fibrosis of the erectile tissue and preserve erectile function in the long term. Can be combined with treatment. Vacuum therapy does not exclude medication. On the contrary, when combined with PDE5 eye drugs such as Viagra Cialis, it can increase overall effectiveness. Frequency of use. For treatment and maintenance purposes, most men only need 2-3 times per week. Some people choose to practice daily as physical therapy for the penis in order to improve blood circulation in the long term. The important thing is not to overuse it, because prolonged suction time can easily cause bruising. Types of devices on the market. Manual pump cheaper, easy to use, but requires more manual effort. Automatic pump creates a more stable and safer suction force, suitable for older men who want to save effort. Safety notes. Always consult a doctor before use, especially if you are taking anticoagulants or have cardiovascular disease. Do not keep the constriction ring for more than 30 minutes, as this can cause tissue hypoxia and damage to the penis. If pain, bruising, or abnormal numbness occurs, you must stop immediately and adjust the way of use. Medical evidence. Many studies have shown that vacuum therapy helps increase blood flow to the erectile tissue, improves penile rigidity, and reduces the risk of penile shrinkage after prostate surgery. This is why it is recognized by many urological associations worldwide as one of the non-invasive therapies to support the treatment of erectile dysfunction. When applied correctly, vacuum therapy not only improves the ability to bring blood into the erectile tissue immediately, but also contributes to training the blood vessels in the long term. If the first 2 methods focus on muscles and immediate blood flow, then the next method I am about to share will aim at improving the structure and function of blood vessels in depth. A sustainable strategy for men's sexual health. Exercise 3 penile traction therapy to improve blood vessels and tissue elasticity. A method that is rarely mentioned in common discussions but is highly valued by many sexual rehabilitation specialists is penile traction therapy, PTT. Initially, this device was developed with the purpose of supporting the improvement of penile length. However, many modern studies have shown that PTT is also a therapeutic tool that can improve blood circulation, the elasticity of erectile tissue, and even the vascular structure inside the corpora cavernosa. Mechanism of action. Penile traction therapy works on the principle of continuous and gentle stretching. A stable traction force is applied along the shaft of the penis for a long period of time. This traction stimulates the process of tissue remodeling and angiogenesis. As a result, the erectile tissues become more flexible, more elastic, and the ability to conduct blood during erection is significantly improved. From a scientific perspective, this phenomenon is called the mechanotransduction mechanism. When mechanical force acts on tissue, it activates biological signals inside the cells, thereby promoting growth and regeneration. Medically recognized benefits: improve erection. Quality: when blood conduction is better and erectile tissue is more elastic, both rigidity and erection duration are improved. Affect shape and size. Many studies show that after 3 months of regular use, length can increase slightly and abnormal curvature in Peyronie's disease can be reduced. Prevent fibrosis of erectile tissue. After prostate surgery, or when there is no regular sexual activity, erectile tissue is prone to fibrosis leading to shrinkage. Penile traction therapy helps maintain normal structure. Non-invasive, low risk compared to surgery or medication. PTT is much safer when used correctly. Safe practice guidelines. Recommended duration: 1-2 hours per day, divided into multiple sessions continuously for at least 36 months. Adjust traction force. Start with light force, then gradually increase according to the manufacturer's or specialist instructions. Choose the right device. The device must be adjusted to the correct size to avoid compression causing pain or numbness. Absolutely no rushing, overuse, or increasing the force too quickly can cause inflammation, bruising, or tissue damage. Who should consider using it? Men after prostate surgery wanting to maintain or restore erectile function. Those with Peyronie's disease, abnormal penile curvature, men who want to improve blood circulation and erectile tissue elasticity as a long-term drug-free solution. Clinical evidence. A study published in the Journal of Sexual Medicine showed that after 6 months of applying PTT, many patients not only improved erectile function, but also increased penile length by an average of 12 centimeters. In addition, reports from sexual rehabilitation programs in Europe also recorded a high satisfaction rate when PTT was combined with other methods such as PTE5I drugs or vacuum therapy. This is a strategy that requires patience and discipline, but in return, it brings extremely valuable results for men's sexual health. And if the first 3 methods focus on muscles, immediate blood flow, and erectile tissue structure, then the next part I want to share will go deeper into the internal supporting factors, helping the erection mechanism operate more smoothly and maintain stability over time. If you are still watching the video up to this point, I truly appreciate your patience. Leave the number 3 in the comments below so I know I am not talking to myself. Part 2. Internal support with a natural supplement formula. In addition to the training and therapy methods I've shared, I often recommend that my patients combine them with an internal support solution to maximize results. One of these is Red Boost, a dietary supplement designed to target the root cause of declining erectile function, oxidative stress around the smooth muscle of the penis. The smooth muscle plays a key role in keeping blood inside the erectile tissue. When the smooth muscle is healthy and functions effectively, blood is locked in for longer, helping to maintain a firm and stable erection. Red Boost combines 5 natural ingredients: L-citrulline, tonnit, alli, maca, ecarine, and nettle root. These compounds help boost nitric oxide production, improve blood circulation, and naturally support hormonal balance. With just a small serving each day, this product can become a part of your overall strategy to enhance performance and confidence. When combined with the above methods, you'll create a solid foundation for long-term sexual health. My friend, today we've gone through 3 science-based methods to improve erection strength and enhance male sexual function. Schedule exercises to strengthen the pelvic floor, the foundation for control, and maintaining an erection. Vacuum therapy to stimulate blood flow into the erectile tissue and provide immediate support. Penile traction devices to improve blood circulation, increase tissue elasticity, and maintain long-term vascular health. By adding internal support solutions like Red Boost, you'll have a comprehensive strategy that works both from the outside in and the inside out. The most important thing is this: your success doesn't come from the magic of any single method, but from your consistency and proactive care for your body every day. Once you start and keep going, you'll soon feel positive changes, not only in your intimate life, but also in your overall health and self-confidence. If you found these tips helpful, don't forget to subscribe to the channel and turn on notifications so you won't miss any valuable health advice for men in upcoming videos. Wishing you health, vitality, and endless energy. I'll see you in the next video.